Hello. I am Ruth Keys, a phlebotomist at Children's Hospital, Oakland, for 42 years, an executive board member of NUHW. I have the honor of introducing a long friend of NUHW. He has been at this podium before. Our interest has been his interest. Paul Sun is an oncologist and progressive activist. In 2013, Dr. Sun was named and served as the very first visiting fellow on the healthcare policy in the California Department of Insurance. In addition, Dr. Sun served on the executive board of Physicians for National Health Program, California, People for the American Way, and the Asian Pacific American Institute for Congressional Studies. Dr. Sun was also the former director of Courage Campaign, in which NUHW has long been affiliated. Paul is truly an extraordinary individual, so trusted by us that last year when he showed interest in running for the insurance commissioner, NUHW was quick to endorse him. He understands what the healthcare crisis is all about, and stands with us in finding ways to address the greatest concern of all Americans, healthcare. In fact, on September 28th, Dr. Sun is taking a leading role in organizing a meeting of coalition partners to formulate a strategic plan to accomplish single payer in California. We welcome his leadership in finding a practical way to achieve this long-needed rights for all Californians. Please welcome our friend and great ally, Dr. Paul Sun.
Well, first of all, thank you so much for allowing me to come here on a Saturday. Hopefully there's enough coffee and you'll stay awake. But I just want to say, before I get into the talk, I really will hope that you'll just look at the pictures and images. I'm going to make the slides available so you can really go back and look at them at your own time. Please don't, spend a lot of time taking notes. And if you're starting to fall asleep, just pinch yourself, okay? I just want to say one thing about your president, Sal Rosselli, who has been a dear friend of mine. My wife and I moved to California in 2007. And I met Sal maybe 3 or 4 years after moving here. And when ever since I met him, I've been all in with him because I just admire him, respect him for all that he has done. When I met him, NUHW was going through some really difficult times, but he never lost faith, never gave up, didn't care what people said about him. He just was doing what was right, and now look at you today. So I think that says a lot about Sal. With that, I'm going to just give you a little bit of a primer on Medicare for All, what the state of our healthcare system is, what we're doing here in California, and really kind of bring it to a point where hopefully you all can understand why we can't just rest on what we have as a healthcare system. So my mom came, so for those of you who may know Miss Shirley Chisholm, she was the first African-American woman elected to Congress. She was also the first woman to run for president back in 1972. She ran under the mantra of unbought and unbossed, which I wish all of our politicians would run by that. But why she's dear to me and my family is that in 1951, my mom came to the United States as a refugee during the Korean War. And after many years of learning English, and eventually she would graduate from Columbia Teachers College, and the first person to hire her was Miss Chisholm. Before Ms. Chisholm ever ran for Congress, she was the director of several preschools that ultimately were the model for Head Start. And she hired my mom as a teacher, and then when Ms. Chisholm ran for Congress, she basically trained my mom to go take over the Head Start program in Newark, New Jersey. But Ms. Chisholm in 1972 said this: "We have never seen health as a right. It has been conceived as a privilege available only to those who can afford it, and this is the real reason the American healthcare system is in such a scandalous state." This was 1972, right? 46 years ago, and I would argue that our healthcare system is in as much a scandalous state now as it was when she said this back in 1972. And we've all seen these statistics before, that we spend roughly twice as much per person on healthcare, and yet we lack in terms of health performance. We're at the very bottom, and still to this day we have 29 million people who are uninsured here in the United States. We also have a higher infant mortality and lower life expectancy, and what's really staggering is the best state in the United States that has the lowest infant mortality is New Hampshire, but worldwide it would rank 28th worldwide. And you have countries such as Turkey and Mexico that have a overall better infant mortality than Mississippi. Now, it's gotten so bad that this was a poll that came out just recently in February that basically showed that now up to 74% of the United States, people living in the United States, no longer believe the US healthcare system provides good value. And I think we all know that quite well. So I'm a radiation oncologist. I've been a radiation oncologist for 20 years, and during that time I saw so many of my own patients who developed cancer become bankrupt. Mainly because they couldn't afford medications, they couldn't afford their co-pays, deductibles, and the sad part is that the majority of people who actually go bankrupt have insurance. And this was one of the things that Senator Sanders said: in the United States, you should not be forced into bankruptcy simply because you're diagnosed with cancer. But we have this way too much of a problem. And here's the thing: everyone thinks that bankruptcy only affects a certain population, but if you look, we have roughly people between the ages of 25 and 44, that makes up almost 46% of all the people that go bankrupt. So the idea that somehow it's just limited to one age group or something is not true, but this is really, really a serious problem with or without the Affordable Care Act. The other thing I would point out is you have two columns here, and I would ask you to look at the column on the left, which is the insured column. These are people that have insurance that reported having significant medical problems due to their illness. If you look, there was 34% who said they were unable to pay for food, heat, or housing. 37% had to borrow money from friends or family. And that 11% sought the aid of a charity or nonprofit. These are people with insurance. I always thought insurance was there to protect you from the financial harm if you got sick. After all, isn't that why we're paying so much? And isn't that why you guys are sacrificing so much of your labor wages to pay for health care? So during the run-up to the Affordable Care Act, I was very much involved debating on behalf of a better health care system. Now, I was hoping that President Obama would really go all the way and give us single payer or at least a public option, but we didn't get that. But still, nonetheless, when I was debating, the person I debated most of the time was Ron Paul, who was a libertarian and also a doctor. And what Ron Paul kept saying is, we don't need more government, what we need is more freedom. So let's talk about freedom. First of all, everyone said it would be a job killer. And if you look at the graph on the left, the lowest point is when the Affordable Care Act was passed. And since that time, as you know, job growth has continued to grow up every single month. So the idea that somehow a government-mandated healthcare system is going to kill jobs is simply not the case. The other graph on the right is from the Cato Heritage Foundation, which is a very conservative think tank. And if you look, these are all the countries that have, quote, better economic freedom. All the countries that are ranked ahead of the United States, except for number 10, are, what do they all have? Universal health care. So the idea that somehow universal health care is either a job killer or that somehow it takes away freedom is simply not rooted in fact. And here's the reality, as many of you know, when you're bargaining with your employers for health care, is that employers have it tough too. In 2018, average health plans were going to cost about $14,000 per employee, some places even more. It got so bad that Warren Buffett's right-hand man, Charlie Munger, said that medical costs are the tapeworm of American economic competitiveness. Our cockamamie system gives our companies a big disadvantage in competing with other manufacturers. They've got single-payer medicine. we're paying for it out of our company. So you're starting to see a sea change. Maybe not with some of the people that you are directly negotiating with, but I think some of these other people are finally waking up to realize this is a real issue for them. So I think when we take this fight out, we need to start decoupling those that have been in, like the Chamber of Commerce and things that have been so favorable to the insurance industry, and realize that they're not friends with each other. If anything, the insurance industry is kind of screwing them over too. So here's the other thing which I think many of you are aware of one way or another, is that over the last many years, not only are you asked to contribute more of your paycheck towards your health care, but on the front end, but when you get sick, you're asked to contribute more in terms of co-pays and deductibles. All the while, your wages have remained pretty stagnant. And here in California, from 2002 to 2011, actually, if we take this now out to 2018, insurance premiums have gone up over 200% during that period of time. Inflation during that time has gone up about 35%, where wages have remained stagnant. And can you think of any other industry that continues to do well in a recession other than the health insurance industry, right? And when you think about it, everyone is always saying that they don't want the government to get between you and your patients or you and your doctors, when in reality it's the private insurance industry that is always getting in the way. In the last 5 years here in the state of California, there have been over 45 million denials. And most of those denials, what they're banking on is that it's too painful for you to fight the insurance company. But if you take the time, and you and your doctor take the time to work it up, every case manager, spend hours on the phone getting shuttled around, 50% of all denials get overturned. What does that tell you? That they're hoping they're going to make it so painful that you don't bother to fight it. But in reality, they're unnecessarily denying things that should not be denied. And in the meantime, let's not forget who is doing well in this climate. Most of the health insurance stocks since the Affordable Care Act are at all-time highs right now. Profits are really doing quite well. And if you look at, these are the wages that a lot of the CEOs made in 2016. A lot of these CEOs made more in one day than the average worker makes in a year. And what do they do with that money? They basically use that money to buy off our legislators. Now, in the run-up to the Affordable Care Act, there were 3,300 registered healthcare lobbyists for the 535 members of Congress, so roughly 6 lobbyists for 1 member of Congress. They ended up spending more than $1.2 million a day, and in total more than what was spent on the Bush-Kerry election to basically get the bill that they wanted. And that's why there was no single payer, that's why there was no public option, that's why there was no insurance rate reform, and no drug pricing regulation. And this is why the LANCET, which is a highly reputable medical journal, said the healthcare reform process exposes how corporate influence renders the U.S. government incapable of making policy on the basis of evidence and in the public interest. So while the Affordable Care Act did do some really good things, we went from 50 million uninsured to 29 million uninsured. We still have 29 million people that are uninsured today, of which 2.7 to 2.8 million are here in California. And of the 2.8 million here in California, roughly 250,000 kids remain uninsured here in California. Now, about a quarter of them are for our undocumented brothers and sisters. Some are, they just can't simply, even with the subsidy, afford health care. Some have chosen not to get coverage. But the fact is there's still too many people that are left out. And just to point out one thing about our undocumented brothers and sisters, they pay a lot in state and local taxes. And the idea that somehow they're just taking and not giving back is simply not the case. And as a result, they can't even get any benefits for what they're paying in terms of taxes. Now, what happens is a lot of the hospitals, maybe a lot of the hospitals that you work with, who take care of uninsured or undocumented, claim that that's why they need to go charge $36 for a Tylenol when it costs 50 cents. That's why they claim that they charge $137 for an IV fluid bag when it costs less than $1. And that's what's really ironic is if you cut your finger and go to the emergency room, it is far more expensive to have it stitched up in California than in other parts of the country. And a lot of these hospitals say, well, we're doing it to basically offset our uncompensated care. But let's look at uncompensated care. Most of the, quote, not-for-profit hospitals deliver a paltry amount of uncompensated care. And I know that a lot of these hospitals enjoy generous tax breaks because, quote, they have community benefit. But if you're not able to take care of those people in your community who need it the most, where's the community benefit in that? Now, as a result, because they tack on costs, quote, under the guise that we're paying for uncompensated care, our premiums are all much higher, and our costs of getting treated ourselves is much higher. And if you look, this is since the Affordable Care Act kicked in, the number of people that report having difficulty paying their insurance premium each month has actually gone up in 2015 from 27% to 37% in 2017. And then the number of people that said they have trouble paying for their deductibles is gone up from 34% to 43%. So the idea that somehow healthcare is getting better in the last several years, it's simply not rooted in fact. There were also, one thing I would point out, the idea of underinsurance, meaning if your copays and deductibles are so high, roughly 1 out of 3 people has delayed seeking care. So imagine if you felt a lump in your neck or something, and you had one of these bronze plans where your deductible was $6,800 a year. That means the first $6,800 of any expense you have to pay out of your pocket before insurance kicks in. Most people don't have that kind of money sitting around, so what do? They wait and wait and wait until that lump has turned into a massive tumor. And this is the reality of being underinsured. So you have a lot of people in this state who believe all we need to do is increase coverage, get everyone coverage. But half of the people that have, well, a third of the people that have insurance, the insurance isn't worth the paper that it's printed on. So having coverage doesn't automatically equate to having access to care. It's gotten so bad now that this, again, was from February of this year. More Americans now, on the left-hand column, are more afraid of going bankrupt or having medical expenses than actually getting sick themselves. That's how bad it's gotten. And here in California, it's remained bad. 53% worry they cannot pay medical bills if they get ill, and 60% reported it was difficult for them to afford health care in general. So that's roughly 2 out of 3 people say that they can't afford health care. And as I mentioned, we have now about 2.8, 2.9 million Californians who are uninsured. Roughly 1.8 are undocumented brothers and sisters, and then you can see the other groups there. Now, here's the thing about California. When you hear politicians say everything is fine, we don't need single payer, it's too expensive, this is from Betty E. I just want to point out. So the top is in 2017. She reported that the unfunded healthcare retiree liability was $77 billion. In 2018, it had grown to $91.5 billion. So just in 1 year, it had gone up $14 billion. This is money that our state is on the hook for, and yet they say, oh, let's not worry about addressing our healthcare problems. And also with regard to schools, schools face roughly a $24 billion retiree healthcare cost liability. If they didn't have to cover healthcare long-term for their employees and retirees, think of how many more schools we could build, how many more salaries we could increase, how many more computer rooms we could build, and all the things. We could bring nurses back to every school, things of that nature. But instead, money is being siphoned away to pay for a failing healthcare system. The other thing I will say that Peter Lee likes to talk about the success of covered California, and yes, compared to other states, it is positive, but here just this last year, rates will rise 12.5%, and of all the states, California ranks near the bottom in terms of narrow networks. What that means, if you sign up for a healthcare plan, you're supposed to be able to see a certain number of doctors and hospitals in that catchment area. But yet, most of you are probably sitting in a location where you only have access to 25% of the doctors or clinics actually in your plan that are, quote, in your network. So if you're in a car accident and you get sent to one of these other hospitals or doctors that are not in your network, a lot of those expenses could potentially fall on you. And here's the other thing about Covered California. Roughly 66,000 people who are on Covered California only have access to one plan. So for them, they already are in a single payer plan. And then about Medi-Cal. I'm sure some of you take care of Medi-Cal patients. I've always prided myself in being in a group that's always taking care of Medi-Cal patients. The physician reimbursement is so bad, we're 47th in the country, that a lot of the doctors that I try to refer patients to won't see them. And as a result, the waiting list for patients who are on Medi-Cal to actually see specialists or other doctors are quite low, is very long. And so MALDEF, the Mexican-American Legal Defense Fund, is actually suing the state, claiming that Medi-Cal is separate and unequal. And that is the reality, that while Medi-Cal has helped to provide some level of coverage, it's still a second-tier system. And then prescription drug prices. And sorry to depress you. I'm going to just give you a few more depressing slides and we'll talk about more positive things. But last year in 2017, 45 million Americans reported that they at one point went without filling a prescription because it was too expensive. Roughly 22% of seniors avoids filling a prescription because it's too expensive. And now the majority of people believe that drug costs are unreasonable, and yet we have a Congress that refuses to allow Medicare to negotiate drug prices, or we have a state that really refuses us to regulate prescription drug prices. So let's not forget what these guys make. These guys actually make the health insurance industry CEOs look like paupers, right? So the bottom line, I think, is why are we spending so much as a country and getting so little? And this will just show you that from 1970 to 2015, the green line is the number of physicians that have come out of training during that period of time versus the number of hospital or, quote, insurance administrators, many of whom are hired strictly to find a way to deny your care. And this is, again, just showing you that on the left is the per capita spending in the black line. It seemed to balloon once we got all these administrators. And down below is the spending of Medicare Advantage, the privatization of Medicare. The curves kind of look similar, right? All of a sudden, when we decided to privatize Medicare, so did our costs went up quite a bit. And I'm sure for those of you who are constantly either on a computer or having to fill out paperwork, you know this feeling all too well. This is our current healthcare system, right? We have Medicare, Medi-Cal, we've got HMOs, we've got PPOs. And the reality is that let's say you have a contract, this year you have United Healthcare and it's a PPO, but then next year you have Aetna HMO. You may not be able to go back to your same doctor's office or same hospital. And so if you're that hospital or physician's office and you walk through the door, immediately they have to look at your card. They have to see, are we in your network? Are we not in your network? What's your copay? What's your deductible? What's covered? What's not? All of that inefficiency then gets translated to actual decreased patient care or money that's actually going to actually take care of patients. Then if you cycle into Medicare, then it all changes. But this is our current healthcare system. It's very, very complicated. And it's gotten so bad that the average hospital in the United States spends significantly up to 25% of its budget on administrative fees than it does on actually anything else. The number of physician hours that an actual physician is not able to take care of patients but actually has to spend time fighting with insurance companies for pre-authorization is roughly 20 hours a week. And so it's one of those things that all of this is really taking away from what we're all in the system to do, which is actually to help the lives of patients. And as a result, we have the least efficient healthcare system, and we also have one of the most wasteful healthcare systems, of which the administrative waste component is the largest waste of our healthcare system. Now, I just want to point out where the United States ranks in terms of patient satisfaction. On the report card, we're not anywhere on the left. South Korea, where my parents are originally from, has a single-payer healthcare system, and they had the highest satisfaction among patients. And then if you look at the Bloomberg World Ranking in terms of efficiency, we're not even on this list at all. So if you were trying to diagnose our healthcare system problem, we do have a parasite. Now, there are a lot of problems, but I would say the largest issue is obviously the fact that we have a middleman whose interests are not aligned with either you as a provider or you as a patient, meaning that the more they have to pay out to actually take care of you, the less they make in turn. So that is a big, big problem. And just to point out that among doctors, the physician burnout rate is actually quite high, and now for the first time, more than 50% of doctors actually support a Medicare for all system. So I want to just point out to something that is working. So on the left, on the left is my dad and I. I was born 30 days before Medicare. So these are sort of contemporary pictures here. But you see Harry Truman there and Lyndon Johnson signing Medicare into law. And let's just talk a little bit about Medicare, because it's really been slammed quite a bit. It's on constant attack by the Republicans in Congress. But Medicare, despite the fact that it takes care of sicker, older patients with more chronic conditions, has lower overall overhead in terms of administrative costs compared to private insurance, private Medicare, and has done the best job in terms of keeping costs down. If you look at the private insurance, they've, for all, quote, the efficiency of the private sector, they have not done any, shown any proof that they do healthcare better than the government does. And at the same time, you have to realize Medicare would be doing even better if Congress didn't keep screwing around with it. What I mean by that is, as I mentioned, Medicare is not allowed to negotiate drug prices. When Kaiser or United Healthcare uses its market power to get the best discounts on drugs, it's considered good business sense, good free market. But if the government tries to do that, God forbid, if Medicare tried to do it, it's government interference. And as a result, you know, prescription drug prices are climbing, and that's what's causing Medicare costs to go up. And that's why seniors are actually getting less coverage for other basic goods, because the pharmaceutical prices are consuming more and more of their budget. And as you look, what does the pharmaceutical industry do with the huge profits they're reaping? They lobby Congress. Now, we are moving to a single-payer system, whether or not it's government-run or whether or not it's through the mergers of multiple insurers. This is just showing you there were 3 big proposed mergers that the Obama administration had objected to, but the Trump administration has said that if they reintroduce this, they may be more favorable to this. But eventually we are, and why do they want to merge? Why do they want to come together? Because they see the benefits of single payer too. It's more efficient, more cost effective, but instead of passing those savings on to us in terms of lower premiums or maybe higher reimbursements, they're going to use that to pay back shareholders. It was so bad that Peter Lee, who is the head of Covered California, took the sort of, I think, very unfortunate approach to write an op-ed to Wall Street Journal defending mergers. He said, policymakers should consider the potential benefits of industry consolidation. The greater efficiency and market power of larger insurance plans could lower prices for consumers by offsetting the bargaining power of healthcare providers. He's making my argument for single payer. So this is single payer. Instead of that convoluted system, you basically have people pay into one system. It's run one way. You have a card or a number, whatever hospital you go to, whatever your doctor you see, they know it's your number for life. There's no copays, no deductibles, and it just simplifies things in a way that would make things much easier for all of us. And this is really the comparison of the two systems. So there are 3 single-payer proposals that have been proposed in the last few years. There's the HR 676, which is the bill in the House of Representatives. It was originally introduced by John Conyers, has been taken over by Keith Ellison. Now it looks like it's going to be taken over by Pramila Jayapal. It has 123 co-sponsors, the most it's ever had. And there's now a Medicare for All caucus made up of 72 members. And then you have Bernie Sanders' Senate bill. Now, I should point out that in 2013, when he introduced this, he didn't have any co-sponsors at all. And now he has 16 co-sponsors. And that our state senator, Kamala Harris, was the first senator to co-sponsor this. And then we have, yes. And then we had our effort at single payer here, 562. So I just want to get into just a little bit of 562. I certainly think that it had some issues, but I want to just share, be completely transparent of what was brought up. So Speaker Rendon, who I consider to be a friend, put this on hold. Whether or not the reasons he put it on hold are legit, that's up for people to decide. He called it woefully incomplete, and there were 4 glaring things that it didn't address. One is obviously the federal waivers. Even if we pass this through the state, question was, would the Trump administration even give us the ability to implement this? Legitimate question. Prop 98, which requires a minimum percentage of the budget, roughly 40% be spent on education. How would you raise the money to pay for this and deal with Prop 98? Legitimate question. The Gann Amendment, which set a maximum limit on tax-funded government services. Again, that was an issue that was not addressed. And then ultimately, what I think really was the hardest thing for this was the GOP tax bill, which caps state deductions right now at $10,000. If you're going to try to raise taxes on everyone and it's already capped your state deductions, how is that going to fly? So there were legitimate, real issues with 562. Still, I think when he calls it woefully incomplete, I think what was woefully incomplete was the political will, and let me explain. So first of all, he said that there was no funding. Well, there was a bill introduced that was going to give electric car rebates, but there was no funding. This was a story that was in the LA Times. California's bullet train was basically funded with no end in sight, right? It's highly dependent on federal money. They don't even know if they're going to be able to complete it now because it's way over budget. And if they don't get the federal funds towards that, the matching funds, they're really cooked on that. So these are 2 examples of where our state has no problems, going all in on something. Sorry, I didn't want to use that because that's a positive way. Committing to something that is not fully baked, and yet they're criticizing the single-payer legislation for something like that as well. Second thing is political will. So let's remember the cap-and-trade bill that was originally introduced, right? It was killed in the assembly because we had a lot of mod Dems who were beholden to the oil caucus who refused to let it pass. And what happened was Kevin De Leon, Speaker Rendon, and the governor said, no, we need to do something. So they did a gut and amend where they cut it completely, replaced it with something else because the political will was there. And I would argue that with regard to all of the issues that I talked about, that if people were really serious about trying to have a single-payer bill, you could get the brightest minds in a room to really work on this. And if they couldn't achieve it, so be it. But to not try, really, I think, and just call it woefully incomplete, I thought was really more symptomatic of just they don't want to do it. It's not that, they, quote, want to do it, they don't. And speaking of why don't we get the healthcare system we deserve, so some of you may know I was a surrogate for Senator Sanders in his presidential campaign, and at a rally I made a comment that caused a lot of controversy. I specifically said that the reason we will never have single-payer health care is as long as we have corporate democratic, and I use an unsavory term, for those that are consistently beholden to the private insurance industry and the pharmaceutical industry. Well, again, for those of you that were offended, I want to say I deeply apologize for that. What I would also point out is 2 weeks after that happened, President Bill Clinton actually called my wife and said that he and the secretary actually had watched my speech and they realized I was not referring to the secretary with that term. And then President Clinton proceeded to recount his own battle with Congress when he was president trying to get health care reform through. And he said, you know what, it was the Democrats in Congress more than the Republicans who really were giving me a hard time. Now, they were never going to let me off the hook in the heat of the debate. And again, I apologize for using the term, but let me just show you what I meant by that. So this is a couple of things that have come out since that speech that for those Democrats in the Senate who have refused to sponsor Senator Sanders' bill, the majority of those that have refused to sponsor have received twice as much from the insurance industry as those that have sponsored them. This was, Senator Sanders had introduced an amendment to allow the reimportation of drugs from Canada, and 12 Republicans actually voted for the amendment, meaning that if every Democrat voted for it, they would have won this. Actually, if only, but instead, 13 Dems voted against it. Now, all the Democrats who voted against it, look how much money they got from the pharmaceutical industry. So I'm not saying the term I used was the right term to use, but I'm not saying it was wrong either. Then let's talk about California. If you look at the amount of money that the legislators who opposed single payer got from the industry, here are the two leading members of the Health Committee. Here's what they got. Now, is that coincidental with why they were the biggest leading opponents of 562? I'll leave that up to you guys. So this is what I call the axis of medieval, right? You've got big pharma, the insurance industry, the AMA, and the GOP. Now, one thing I will say about the CMA is that it's changing. For the first time, there was a group of young doctors that demanded we begin to thoughtfully study the role of single payer here in the state of California. And in another 10 years, I think a lot of the people who have been obstructionists, who've enjoyed their golden lives of medicine unfettered when they were treated like gods, are either going to be retired or move on. And I think as a result, you're going to start to see a sea change within the CMA as well. So here's what I will just say about single payer here in California. What people need to realize is if we don't do anything next year, nothing's going to be done because 562 is dead. The state is going to spend about $368 billion a year on health care, no matter what. And the media said it would be $400 billion, but this is what we're going to spend no matter what. And when you basically allow the state to negotiate drug prices, bring down costs, make it more efficient, you are going to save money. And that's really at the heart of what a single payer plan is. Now, recently, Fox News, there was a report that was funded by the Koch brothers. I'm sure some of you heard about this. There's an institute at George Mason University outside Washington, D.C. called the Mercatus Institute, and they did an analysis that basically found the Sanders bill was going to cost $32 trillion. And Fox News went and was laughing, it's going to cost $32 trillion. But they posted a survey on Fox and Friends that it would cost $32 trillion, and would the benefits outweigh the costs, and look what the response was. And just to point out what that study, what the press, and it's not just Fox News, the corporate media also didn't pick up on this. They just said it was going to cost $32 trillion. But what it didn't say was that if you insure every single person in the United States, increase their benefits, it would still be $2 trillion cheaper than if we did nothing. This was a Koch brother funded study. But all you heard was it was going to cost $32 trillion. Didn't tell you it was going to save $2 trillion over 10 years while getting everyone, including our undocumented brothers and sisters, coverage. And I'm almost done. The one thing that you should also realize when people say, well, we can't afford it, the reality is for every healthcare dollar spent in the state of California, 70 cents is already being paid for by us, the taxpayers. So we're paying for something. Coupled with the fact that the insurance industry takes roughly 30 cents of every healthcare dollar away from actual patient care, the money is there. So when people say that, oh, we can't afford it, tell them it's our money that's already paying for this healthcare system. We deserve the healthcare system we deserve. Now, one thing that Secretary Clinton did say during the primary was that single payer would never happen. She likened it to like ponies, that Bernie just wanted to give everyone a pony. Well, here are all the countries that have ponies. And then recently, President Obama, when he was senator, he said he was for Medicare for all, and then it went away from his vocabulary, but then came back just 2 weeks ago and said he thought Medicare for all was a good idea. So think of, what else can you think of that has had such a rapid sea change in such a short period of time? meaning that 2 years ago, even in our own Democratic Party, it was considered a taboo. Now you have all these people that are warmly embracing it. I think what we can learn is the marriage equality debate. When my wife and I first moved here, Prop 8 was just being introduced, and and then look at what happened in several years. Not only did you have states embrace it, the federal government became the law of the land. And I think that in much the same way, that's the sea change that we're seeing now with regard to Medicare for all. It's gotten to the point where now 70% of Americans support Medicare for all. This was a poll that just came out a month ago, including 51% of Republicans. So things are changing. And why is it changing? Because just like when people were coming out to their neighbors and coworkers and family members, in much the same way, I think people are sharing how this healthcare system is hurting them and how we can do something better. And that's what I think. And when I first started fighting for single payer 20 years ago, it was really mostly white hippie doctors from Berkeley and elsewhere that you would see at rallies. Now you see people of all ages and all colors and all political persuasions that now realize they deserve something better in their healthcare system. So I had my so I just want to say this. That's my daughter and myself last year. We actually had our whole family dress up as ponies and unicorns. Finally, I just want to say two last things. Some of you may have heard of the late Quentin Young. He was Martin Luther King's physician. He organized physicians initially to go down and march in the South and really just take care of people that were wounded during protest march. He then became the head of Cook County Hospital's family medicine program in Chicago, took care of Dr. King, took care of President Obama, and he passed away a few years ago. But I want to just share a quote that Quentin Young said. Over the years, I have aligned myself with unpopular causes. I've worked to replace the worship of the market with concern for the common good, social justice, and tolerance. Over time, the American people generally do the right thing, and I'm confident they will see that national health insurance is no longer the best solution, it is the only solution. And I think this is what's happening here in the United States. And finally, I just want to say this. Dr. King said, human progress is neither automatic nor inevitable. Every step toward the goal of justice requires sacrifice, suffering, and struggle, the tireless exertions and passionate concern of dedicated individuals. NUHW, you echo Dr. King's words. Thank you for all you do, and thank you for having me here.